Every year, thousands of graduate medical school students do not get all of them into a residency program.
Well, so that's why Missouri was the first to allow these grads to treat patients without going through residency. And 41 Action News anchor Taylor Hemnes went to 2 clinics where these doctors work.
Hola, buenos días, ¿cómo está?
Dr. Yasser Mustafa works at the Medina Clinic in Grandview.
Okay, todo se ve bien.
He speaks 3 languages and calls caring for people his passion.
That's what I've signed up from day one.
He is an assistant physician, one of only 25 now licensed in the state of Missouri. He graduated from medical school, passed his required tests, but was not accepted into any of the nearly 60 American residency programs where he applied.
You've spent so much time, going to med school, undergrad.
Now he's here and sees patients every day at a free clinic. He's hoping this will make his qualities more attractive as he reapplies for residency.
Not being able to get paid for it and still do it, that shows how much passion an individual has in a certain area.
For us to literally throw away doctors, qualified doctors every year, and by the several thousands, is absolutely ludicrous.
Dr. Patricia Durgis, another of the state's 25 APs, actually helped State Representative Lynn Morris craft the law. She finished medical school in her 50s, but could not get into a residency program.
This law was not just necessarily, was critical.
She opened clinics in the Springfield area where fellow APs see patients. The law requires APs to have a collaborating physician to check their work.
Maybe the collaborator passes away or he retires. All these patients were thrilled to have a doctor, and now that day you have to lock your door and say, sorry for you.
Right now, there's no way for APs to lose that designation and become MDs without completing a residency program. Dr. Durgis is actually working to craft a bill to make 3 years of work as an AP the same as a 3-year residency.
But not everyone is on board. Dr. David Barbie, a Missouri native and the president of the American Medical Association, told us, quote, "The AMA appreciates that the intent of this law is to bridge critical gaps in the healthcare workforce, particularly those due to limited residency positions. However, we encourage states to pursue more practical workforce solutions, such as increasing the number of state-funded residency positions."
As their collaborating physician, I review everything that they do.
Dr. Wael Murad works with Dr. Mustafa and other APs at the clinic in Grandview. He knows about the opposition to the program and has some of his own reservations, but he says the number of people who aren't getting medical care of any kind is just too high.
I feel that the assistant physician law is conducive to expanding our healthcare team so that we can see more patients on a charitable basis.
The other day, actually, I saw a patient that hasn't been to a doctor in I think 5 or 6 years almost. And when I asked him why, he said, I just don't have the money.
Murad says more conversations have to happen statewide before these APs graduate to seeing more than patients who otherwise couldn't afford it. Taylor Hemnes, 41 Action News.
Missouri was the first to enact a law like this, but other states have jumped in. In Kansas, special permits can be granted to medical school graduates with most of the same rules as the Missouri law, but the person must be a graduate of the University of Kansas Medical School.